Finding Dory is a movie that is centered around family and takes place off of the West Coast in the Marine Biology Institute of California. Dory is a fish that has suffered from short-term memory loss her whole life, until one day she finds herself remembering that she has a family. Throughout the movie, she struggles with her memory and gains clues on who she is, where she comes from, who her parents are, and eventually she finds them.
Anterograde amnesia is the inability to form new memories from facts and events after the cause of amnesia. If Dory would be diagnosed by a therapist in the Disney or American culture, she would be diagnosed with anterograde amnesia. I think, taking a culturally broad view, Dory would still be diagnosed with anterograde amnesia because the symptoms aren't culturally based or can be interpreted based off your culture. The reason is the symptoms of being able to remember new information is not an opinion. It's based off of data or what yes or no. Some stigmas that can be associated with anterograde amnesia in the American culture would be getting lost easily, constantly repeating themselves, easily being distracted in conversation due to losing track of their conversation. They will be forgetful of objects and also constantly be confused due to repeating themselves and people pointing out that they just repeated themselves.
One symptom that Dory shows is that she is constantly repeating herself, which then leads to confusion. For example, Dory confuses herself in the pipes when she is trying to find her way to the ocean exhibit in the movie because she is continuously repeating herself while she's traveling through. A second symptom that Dory exhibits is that she is getting lost very easily and she is forgetful of objects and people. For example, Dory gets lost in her youth, and as she tries to find her way back to her parents, she begins to forget them too. After a few years, she forgets that she set off to find them in the first place. One symptom that Dory does not show is that she does not show a complete inability to create new memories. Dory experiences memory triggers of events which occur whilst having the amnesia. For example, she remembers the undertow and the jewel of Cali. But these memories may have also formed prior to her receiving the damage to her hippocampus.
There is no known cure for anterograde amnesia. Rather, what we treat are any conditions which causes the progressive amnesia. In Dory's case, we don't know what caused it, so we cannot treat Dory in this way. However, due to the fact that she experiences memory triggers, perhaps we can improve certain memories of other fish or ideas through constant association. She only forgot her parents after a lengthy separation from them. So by spending time with the fish or the ideas, she will build the memory of them. Again, there is no known cure for anterograde amnesia, so we can only work to help the patient live with amnesia. There are not really any ethical concerns with this treatment, as there's nothing else we could do for Dory. Dory may struggle with other fishes' patience or understanding, as her prolonged need of exposure to things is what is needed for her to remember them. But because she has great friends and family that care about her, they will assist her emotionally through these tough moments.
For the most part, the film Finding Dory portrays anterograde amnesia well. The film shows that she has difficulty forming new memories, but she still has motor skills such as speech and her ability to swim. However, an issue that stands out in the film is that Dory is able to use keywords or certain visuals to remember events that occurred in her past. People with anterograde amnesia are not able to use clues to suddenly remember information. Also, it is difficult to pinpoint why or when Dory began to suffer from anterograde amnesia. Anterograde amnesia typically forms due to hippocampus damage, but the film does not give a proper cause for Dory's amnesia. We only know that she had it from a very young age. Although it is often stated that people should not believe everything they see on TV, society has a difficult time following that. Films are typically flawed. Finding Dory is an example of one of many films that display disorders mostly, but not completely, correct. If a viewer does not know the background information behind a disorder, then they are likely to believe what has been presented to them. There are often many false assumptions and misunderstandings about disorders presented in the film.